So why is low back pain so prevalent? It's prevalent because our low back is an extremely complex structure. So in your spine, you should have 3 curves. So if you come over here, I'll show you this picture. Okay, so in your spine, you have these 3 curves. Okay, so primarily right now, we're talking about the low back. So the low back should have this really nice curve. Ideally, it should be around 40 degrees. So this curve can physically deviate from normal, and this would create what we call a structural problem. So if this curve physically deviates, you can have too much curve in your low back. This would be considered a hyperlordosis, or you can have not enough curve. So basically that would mean you have a flat lumbar spine or curve in your low back, which would be a hypolordosis. And so without that proper curvature, what happens is we start to load in a way that creates irritation to the discs and the joints and the nerves and the muscles, which ultimately can lead to chronic low back pain. On top of, we also want to look at that low back from the front facing angle, because there can be a tilt in the pelvis, oftentimes due to a short leg. And so if there is one leg that's physically shorter than the other, it creates a complete tilt, which puts even more pressure on the lumbar spine. And now let's think of if we have 1, 2, or 3 of those issues, what happens is it creates multiple dimensions of torque, which creates even more problems for us. So what it looks like on a first visit to come in and get evaluated for your low back pain. Again, there can be lots of things that cause this low back pain. So we like to sit down and get a thorough history with you to see if you've had any injuries or traumas or when that pain started, because all of that will help us to determine the best course of action. But we also take x-rays. And the reason we take x-rays is so we can physically measure that curve to see how much it's deviated, if it's deviated, and then of course if there's any sort of damage or instability in the spine. After that, we'll do a full assessment in terms of a postural analysis. And then this gives us a really good picture in terms of if there's postural distortions we need to address as well. So all of these factors play a key role into what kind of treatment plan we're going to be giving you moving forward. After that first visit, we'll sit down and we're going to go through everything we found on that first visit. And then we will tell you, 1, if we can help you, and then 2, the best course of action to help you get long-lasting type of results. So you may have been adjusted before, where you get adjusted and it feels better. So there's 2 different pieces that we're focusing on, which is the functional piece. So that would be the movement of the joints. But then again, that structural component is so important, and that's what we specialize in here. And to look at the full picture to see what the root cause is in terms of what's physically causing that low back pain. Our goal is to help you alleviate that pain and to have long-lasting results, rather than this low back pain continuously coming back time and time again. So if you have low back pain or know somebody that experiences low back pain, give our office a call and we'd love to do an exam to see if we can help you.